Hello everyone, my name is Rabia and today I am presenting the topic Analyzing Factor Influencing Lung Cancer Patient Outcome. Let's have a look at the introduction. Lung cancer affects countless lives globally and understanding what influences how the disease progresses, how it's treated and ultimately the chance of survival is crucial. Our central question guides this exploration. What are the factors that shape these outcomes across geographic regions, smoking habits, and environmental exposures? To unpack this, we will journey through five key areas, each addressed by a specific sub-question from initial diagnosis to the cutting edge of clinical trials and the impact of our environment. Our analysis begins with a broad look at our dataset. There are 4,60,292 patients. The average age at diagnosis in this group is 60 years. Now think about this. While a hopeful 70% of these diagnoses occurred at an early stage and 30% still identify late. The delay in diagnosis is a critical point we need to address as earlier detection often mean more treatment options and improved chances. What do you think might contribute to these differences between late and early diagnosis? Let's keep that in mind as we continue. Overall, 5-year survival probability across all these patients stand at around 50%. This figure serves as our baseline. The overall chance of 5-year post diagnosis, we will see how this percentage shifts as we consider other factors. Let's now take a global perspective with this map, which visualizes the percentage of late diagnosis across different countries using color. Notice the patterns on the lower end. Countries like Germany, Russia show percentage around 3.27 and 3.28 on higher end as we see Egypt, South Africa, Indonesia with percentage around 3.3 and 3.39%. What could explain these regional differences? Isn't the availability of screening programs, the ease of access to healthcare, public aware campaigns. These are crucial questions to consider. If a country has a high rate of late diagnosis, it suggests a potential need for target efforts to improve early detection. What action might be the most effective in these regions? Let's look. Now let's explore how treatment access influence survival and if the relationship differ based on smoking habits. Here we have a breakdown for former smokers, non-smokers and current smokers, showing the survival probability based on whether they receive full, partial or no treatment. Focus on the dark blue segment representing full treatment access across all smoking groups. Those who receive full treatment show a survival probability of nearly 20%. Compare that to the light blue segment for no treatment, where the survival probability is just 3%. This contrast powerfully demonstrates the impact of comprehensive treatment. Interestingly, this trend holds across all smoking status suggests that while smoking is a significant risk for developing lung cancer, access to the best possible treatment is a major determinant of survival once diagnosed. What does this tell us about healthcare priorities? This is a bubble chart from Tableau. Now let's have a look. Clinical trials offer a chance for a patient to access cutting edge therapies. This bubble chart visualizes who participate based on their cancer stages and smoking history. The size of bubble indicate the number of patients and the color represent the level of clinical trial access. We can see that smokers have a large number of patient diagnoses at stage 2 and 3, and they also show a higher rate of clinical trial participation at stage 2. In contrast, non smoker appears to be less represented in later stages within this trial access view. Why might this be? Could there be eligibility criteria that disappropriately affect certain groups? Ensuring equitable access to these potentially life-saving trials is crucial. What step could we take to make clinical trials more inclusive? Finally, let's consider the environmental factor of air pollution. This chart looks at survival treatment access across area of high, medium, low. Notice that even though the overall survival percentage might appear somewhere lower in the area with high air pollution, the consistent message is that full treatment still lead to the highest survival probability across all level of pollution, suggests that while the environment play a role, the quality of medical care remain critical factor. It's also promote us to think about the broader impact of our environment on health outcome. What kind of public health initiative could address the impact of air pollution on lung cancer patients? This is the overall dashboard chart we have generated from the Tableau. It shows the overall story we have already told in each individual charts. So this represents the findings and conclusion we need to discuss more. Let's have a look at the findings. We have seen that the stages at which lung cancer is diagnosed vary significantly between the countries. We have also observed that comprehensive treatment strongly improves survival chances for patients regardless of their smoking history. Furthermore, access to clinical trial is not uniform across different smoking statuses and diagnosis stages. And finally, our analysis suggests that air pollution level may indeed correlate with both treatment disparities and survival outcomes. These all are critical piece of the puzzle. In conclusion, to truly improve outcome for lung cancer patients, we must focus on enhancing early diagnosed stages, ensuring equitable access to the best possible treatment, and working towards fair participation in clinical research. Moving forward, further investigation into causal links between environmental factors and systematic inequalities in healthcare. Access will be essential to designing more effective and just interventions. Thank you for joining me on these important explorations.